terms of the number, if we see, we have overall around 25 plus million of birth cohort in India. And if we see out of that, 13 to 17% are preterm, which translates to around 3.5 to 4.2 million of preterm birth per year, and 17.5% are around low birth weight babies, which is around 4.5 million. In that also, if we see from the pool data from the different countries, it shows that 20 to 30% stunting beings before 6 months of age, and which is high in terms of vesting, which is between 15 to 31% in LMICs. Globally, the number is around 8.5 million vested infant during 6 months of time period. And this is largely because preterm, low birth weight, small and sick newborn who are largely at a risk of growth faltering, poor weight gain aspects. And in all these aspects, the community role is very much crucial. Why? Because once the child is delivered either by normal delivery or cesarean section, and once the child is back to the home setting, the first respondent becomes the mother or the parents, both the parents or the family members who detects feeding difficulties, whether there is any illness or inadequate growth happening. In terms of the babies who are admitted into the SNCUs in Indian context or an ICU, once they go back to the hospital home settings, their regular follow-up or monitoring at community settings is very much important, which is currently a weak link, which is not happening. And what we observe is that many of the time child is discharged from the hospital, and there is no kind of a counseling being done with the parents, or their involvement being done during the hospital setting. And when they end up doing care at their home settings, they I think there is a huge gap, and they're not able to manage it. And finally child land up into the complication again, into the admission, or maybe that leads to the mortality among the children. So continuing that care at home, at community level, at home level, it's very much important. And growth faltering among newborns largely below 6 months of the age group is kind of a silent aspects, uh, until and unless the caregiver is empowered enough to understand and well oriented, uh, things are very difficult to kind of identify timely, and then timely refer to the health system. So it's the whole of community approach is required for early identification, supporting the growth of a child. So that's how community role is important. Dr. Samir did mention about few of the existing systems, like we have home-based newborn care, where the certain frequency of visits being done by ashas, and extension of it into after 6 months of time period, largely home-based young child care, with the mentioned number of the frequency. Then at community level, we have ashas, anganwadi workers, or the armed sub health centers, where we have the community health officers or the mid-level healthcare providers. We have platforms like village health nutrition days, Jan Arogya Samiti, Anganwadis, who are largely working on the growth monitoring nutrition aspect of a child. Apart from these systems, public health system, we also have at certain places demonstration of mother support group or peer group formation. Certain digital tools are being used, not sure whether appropriately or they very effectively or not, but there are tools being developed to digitally track the growth of a child. Once a child is there in the community. In terms of the larger gap at community level, as I mentioned, one of the gap once the child discharges, the post discharge follow up care, the regular monitoring of child, especially during 6 months of time period, and then while discharging child from the facility to then the counseling which is required, and the care needs to be taken at home, that is being weak. And then the limited engagement of the family members or the father engagement, largely being considered as the responsibility of a mother alone. So that engagement of a family or father is being mixed. In many of the places, what we have seen, there is like tribal region or the rural areas, the role of local practitioner, local healers is very much influential. Rather than trusting on the health system or the qualified doctors, many of the parents still do refer their children to the local healers, and then we like usually see the news and the associated mortality among the children. Like many of the tribal region, we might have read such out on news, and this is very much prevalent in tribal areas. That's what we have seen in about the local healers. So we have very good platform in terms of the newborn NRCs, nutrition rehabilitation centers, but the challenge largely comes when parents start refusing to stay at NRC. Few of the challenges which parents usually mention is that like staying for 10 or 15 days of time period away from their home, lack of transportation, not being comfortable at the health facility, losing wages. Inspired government is giving the wage loss compensation, but they still kind of mention that wage loss is major concern for them to stay back, and irrespective of the how child is sick or suffering with the malnutrition, they take back the child, and there is kind of a loss to follow up also. There are the take home rations available at field level, but what we have seen is the acceptability, the quality of take home ration, and rather than giving it to the child or like the mother taking it, it's usually going to the animal, and all such cases have also been identified. And the acceptability challenge is there in terms of the take home ration. In terms of what Path is doing, so starting from the facility level, then community level of interventions. So one of the research done by Sion Medical College at an ICU and SNCU level, it shows that the babies admitted in SNCU, still 30 to 40% of the babies do not have access to the mother's own milk feeding, either direct breastfeeding or express breastfeeding. So that's a major gap, and to address that gap, Path and as well as the government of India has come up with a model called Comprehensive Lactation Management Center, or CLMCs, in other term, which we call it as a human milk bank, where these are the centers. Again, it's a T level of centers where CLMCs at district hospital or the medical college, lactation management unit is at secondary level, and then lactation management centers at all delivery points. So three level of care, and of which donor human milk bank or CLMC is one such component where the mother who is willing to donate free of cost the milk, that donated milk goes under four level of quality control. One is pasteurization, the other one is pre and post pasteurization quality microbiological testing, the mother screening, and then following all the hygiene and infection prevention practices. So multiple level of quality care practices being followed, and then safe donor human milk is given free of cost with the consent to a baby who is admitted in SNC or NICU. So as I mentioned, 40 to 30 to 40% of babies do not have access. So such babies receive largely in priority of preterm, very low birth weight babies, and then low birth weight and other categories of babies receive this donor human milk. The other site which I mentioned is the lactation management unit, where for any reason a baby is not able to suck, or his baby is in a critical condition, but mother has sufficient milk production. So, helping mother to manage her lactation, to express the milk hygienically, to store the milk hygienically, and then give it to the baby. So, this is largely about the APFI plus or the human milk bank approach, which we kind of supported and working in India and other countries. In India, as of now, around 100 plus milk banks are available in public plus private health facilities, and it's being funded under NHM. Largely, the focus is to strengthen LMUs first at secondary level, and then later on at tertiary level, it's the CLMC. In terms of the behavior change communication based upon the human-centered design approach, we developed the anemia related campaign. We called it as battery full campaign. Battery, because nowadays the use of mobile phone is huge among the youngsters and other adults also, considering that component how the battery of mobile goes down and it needs to be recharged day to day basis. In similar way, human body, considering as a battery, it's going down, it needs to be re-energized in terms of the nutrient. So considering this as a theme which came out after talking to lots of stakeholders in the field, healthcare providers as well as the youths and the people. So this theme was designed, and in terms of so this again multiple tools were designed as per the beneficiaries, as per the healthcare providers, and then this the entire campaign was owned by government of Maharashtra and launched in Maharashtra. So there were few rap songs, there were videos, there were posters, flip books, the takeaways, the job aids for the healthcare providers. In fact, for Asha's, she use for giving the IFA supplementation for the children of 6 to 59 months. Those components were also being covered, and also the roles and responsibility, so that whoever is identified anemic need is referred to appropriate health facility for the treatment, which was kind of seen as a missing link, that once we identified tracking and then treatment completion is not being done. So those were considered, and this campaign is still going on. And apart from this, the as per the as Dr. Shutosh was mentioning, the different like mission mode activities or the weeks are being celebrated. So wherever such weeks are coming up, our teams are supporting on ground in terms of the breastfeeding week or donor human milk day or newborn week celebration, so that there is continuous momentum about this issue is being talked, awareness being spread among the healthcare providers as well as in the community.